Welcome TCI friends and guests to the Challenge Initiative Philippines. Uh, we are going to have our webinar today on the role of leadership in creating adolescent-friendly cities. My name is Raymond Masa. I'm the Deputy Chief of Party of the TCI Philippines, and I will be your moderator. The Challenge Initiative is a global platform that supports local government units in scaling up proven high-impact approaches that will facilitate self-reliance and sustainability while achieving impact. Today, we are featuring the Philippines approach on leadership for adolescents and youth-friendly cities, or LIFE-C. For this 1 hour learning session, maybe we could go to the next slide. Our audio is muted and please ask questions through the Q&A button. Please also note this webinar will be recorded and a link after the session will be shared with everyone, including TCI resources. Recording will also be uploaded in Facebook and YouTube. Each presentation will take approximately 4 minutes. We encourage you to type in your questions in the Q&A box. Panelists will collect, consolidate questions, and address them. To start our program, please let us welcome the Director and the Chief of Party of the TCI Philippines Hub, Dr. Dorilyn Balanova. Over to you, Dr. Dory.
Thank you, Raymond. Good morning, good afternoon, and good evening. Welcome to this webinar. The Philippines ranked second among ASEAN countries with highest number of adolescent pregnancies based on the 2017 National Demographic Survey results of 47 births per 1,000 adolescents. This showed that on the average, around 532 adolescents were giving birth per day. The country wanted to stop this trend, and addressing this included the adoption of proven high impact approaches to reduce teen pregnancies under the Challenge Initiative. The partnership to set up the TCI Philippines Hub was formalized in July 2020 between the Bill and Melinda Gates Institute and Zulig Family Foundation, with the Commission on Population and Development, or POPCOM, as a ready institutional partner to operationalize and scale up TCI. Implementation in 3 pilot cities started in March 2021 and followed the devolved setup, as both health services and population development are devolved functions of the local government units. Our hospitals or curative services were devolved to the provinces and some highly urbanized cities, while preventive and public health services were devolved to the cities, municipalities, and barangays or villages. In our setup, each unit of local government has its own set of funds and other resources, while the national agencies continue to provide policies, guidelines, and capacity building. However, through the years, there were challenges in the implementation of programs as reflected by the country's health outcomes. There were problems in the interpretation of policies and awareness of the true picture of health challenges. Thus, they don't end up as priorities of most local government units. This is one of the reasons why the Zilig Family Foundation, a local NGO in the Philippines, is engaged in the business of building the bridging leadership capacities of local chief executives and other key leaders to improve health systems. We believe in our health change model that says if we build leaders with high ownership of the health issue, they would lead other leaders to fix their health systems so that this would be responsive to the needs of their constituents, especially the vulnerable populations. And this would result in achieving high health outcomes at a faster rate. In this partnership with TCI, in addition to the leadership approach, we have introduced TCI's 4 concentric circle strategy to reduce teenage pregnancies along with high impact approaches from our and other hubs' experiences. Leaders undergo 1 to 3 day modules, followed by practicum where they apply leadership principles in implementing their chosen high impact approaches, as they are also coached and monitored. It is our aim that in sharing our 1 year experience, you would appreciate the role of leadership in addressing AYSRH challenges and consider adopting leadership development work as a new TCI high impact approach in your hub. Also, learn new workarounds in strengthening service delivery, data management, health human resource policy development, resource mobilization, and youth engagement, regardless of form of government. For our local participants, we hope that you gain insights on how TCI Philippines high impact approaches were implemented in the pilot cities to make cities adolescent and youth friendly. Now, let's learn together as we listen to our panelists. Maraming salamat po. Back to you, Raymond.
Thank you, Dr. Dory, for that message. Today, we are privileged to have six respected panelists who will share their experiences in implementing the Leadership for Adolescent and Youth Friendly Cities. We hope that you can gather useful insights from their initiatives and implementation. Our first set of panelists will discuss how the leadership approach and TCI high impact approaches help deepen their ownership of the AYSRH program. Let us hear how this ownership strengthened their commitment in implementing strategic and sustainable AYSRH programming. To expound the topic, leading change through deeper ownership of AYSRH, we have Honorable Mayor Daryl Dexter Uy of Dipolog City. We also have the City Health Officer of Cagayan de Oro, Dr. Rachel Delia, to talk about leading and collaborating with other leaders towards co-created solutions for AYSRH. To highlight how empowering youth leaders for youth-led social behavior change and policy support, we have Mr. James Patrick Santos, Oro Youth Development Officer, Cagayan de Oro, and Honorable Micah Mabel Magbanwa, City Councilor and Sangguniang Kabataan Federation President of Puerto Princesa City. I am now turning over the floor to our speakers for panel one, entitled Building Leadership for Better Ownership and Strategic AYSRH Programming. Mayor Darrell, you may now start, to be followed by Dr. Rachel, Mr. Patrick, and Councilor Micah.
Pleasant day to everyone. Growing up, I was raised by parents who are firm believers that children should grow up instilled with family values and an abiding faith in God. I believe that this provided me with the proper environment that prepared me for my current role as the father of four kids and the father of my beloved Dipolog. This is where I would anchor our efforts to realize the shared dreams and aspirations of our people, especially the adolescents. In 2017, our city joined the City Leadership and Governance Program of the Swedish Family Foundation in partnership with USAID and the Department of Health. My leadership competencies as a mayor was revisited and strengthened by leading better city health systems to achieve better health outcomes. During the program, I was able to do a deep dive activity where I made a surprise visit in one of the villages to talk with a 16-year-old girl who got pregnant. She stopped schooling and went to the city to work so she can support her child. I was disheartened as she seemed to have lost her dreams at a young age. This is not the mindset I want for the adolescents and youth of my city. TCI made me understand the adolescent and youth sexual reproductive health situation, or AYSRH. To effectively lead my city leadership team and advocate AYSRH to more leaders and envision further health equity and outcomes, we need to understand first our data. Our adolescent birth rate, or ABR, in the city was 73.8 in 2018, 55.6 in 2019, and 45.2 in 2020. In 2021, with the implementation of the Challenge Initiative program, our APR is now down to 22.22. We overachieved both the city and national targets. On the other hand, There is also an increase in the modern contraceptive prevalence rate, or MCPR, both of women in the reproductive age and their partners. For me, this is a big improvement because we were able to prevent new or repeat pregnancies from the adolescents through the implementation of TCI's high impact approaches. As a result of analyzing disaggregated adolescents and youth sexual reproductive health data for the Challenge Initiative program, I created a city leadership team called Team Babi, or Batang Ama, Ina Initiative, that will go on the AYSRH work with me. Meanwhile, COVID pandemic response remains a challenge. At some point, we exceeded the bed occupancy rates in our city and province due to the COVID surges, while other health services became a challenge to implement. To continue service delivery without congesting community health centers during COVID, I instructed the health workers to intensify house-to-house campaign for reproductive health services. I allowed activities like the U4U Teen Trail so we can continue to reach out to the adolescents and youth. I supported the needs of the Youth Council by providing a new office and a bigger city teen center and endorsed for a bigger budget at the city and village level. So they themselves will lead the work for their own segment group. We empowered parents and teams to conduct the intergenerational dialogue in their respective villages. This approach enabled the strained relationships between parents and teenagers to improve by having open communication. The Department of Education is now a major partner through a memorandum of understanding to implement the comprehensive sexuality education in schools. I envision our elected leaders to also have the same understanding with me about adolescents and youth sexual reproductive health through the Leadership for Adolescent and Youth Friendly Cities training that will strengthen relationship between our community officials, health workers, youth leaders, and the adolescent and youth. We also ask church leaders representing different religions through the Gabay Adap group to go to the villages to guide and counsel our teen parents. This 2022, we are committed to continue our TCI journey as we allotted from 4.7 million in 2021 to 7.6 million in 2022, which is 59% higher. Our governance in Dipolog is about integrity and sincerity in bringing services to the communities. Once again, I, Mayor Darrell Dexter T, together with our city, barangay, and youth leaders, are committed to work together to lead change so that every adolescent and youth Dipolognos will have a brighter future. Thank you.
Hello, everyone. When City Mayor Oscar S. Moreno expressed his interest to join the Challenge Initiative establishing adolescent and youth-friendly cities in the Philippines toward the reduction of teen pregnancies, he already had in mind a subgroup of the Information Service Delivery Network as the City Leadership Team, or CLT, for Adolescent and Youth Sexual and Reproductive Health, or AYSRH, to be the working group to manage, implement, and monitor the TCI evidence-based practices. The ISDN is a network of government and non-government entities which have programs for the adolescent and youth in the city, which became more collaborative and harmonized with TCI's Leadership in Adolescents in Youth-Friendly Cities program. Responding to Mayor Moreno's call, the CLT conducted a series of consultations to select barangays or villages to be included in the initiative. Criteria for selection were poverty incidence using the NHT-SPR tool, the incidence of teen pregnancy, barangay completion of BHLNP or Barangay Health Leadership Management Program, and commitment of the barangay to counterpart resources to fund the TCI activities. The CLT conducted monthly and quarterly meetings to track the fund utilization, share data, discuss bottlenecks, and resolutions. TCI's inputs and bridging leadership approach has set a common understanding among the members of the CLT in building ownership on leading the responses of AYSRH issues and challenges. The CLT led the grassroots engagement through Live C of village leaders and youth councils, from the whole site orientation, various meetings, dialogues, and training. Increased budget allocation for AYHR. In 2020, 2021, several barangays were already seen in the work and financial plan. The CLT continuously coached the youth council, encouraging them to focus on the projects that they have planned, such as provision of drugs and medicines through Butikan ASK, SK managed pharmacy, training peer educators who will assist in generating awareness and demand for adolescent-friendly information education services on AYSRH, including teen pregnancy prevention and triaging and peer counseling in adolescent-friendly health facility with health workers. Despite the pandemic, youth-led demand generation activities continued, like Teen Credibles, a social media campaign competition on AYSRH, and several activities which improved the AYSRH system of the barangay. Little wins were celebrated to encourage the youth to continue implementing their plans. Indeed, TCI helped define clearer dimension of the interagency efforts that significantly led to minimizing duplication of services, providing unified directions, and structured budget allocations with focus on AYSRH. These health and non-health interventions by the CLT and other ISDN members helped bring down the overall adolescent birth rate from 80.9 in 2019 to 49.46 in 2021, reflecting all the births from city residents and non-residents. Adolescent birth rate of Cagayan de Oro residents showed a significant decrease from 46.26 in 2019 to 33.34 in 2021. Also, our modern contraceptive prevalence rate is 33 and higher than the 2022 national target of 30%. The collaborative action among members of CLT can sustain the initiatives and encourage partner villages to continue improving the AYSRH services. Daghang salamat.
Thank you so much to the Challenge Initiative and Zulik Family Foundation for this opportunity to share our work. I am E Santos, Youth Development Officer of the City Government of Cagayan de Oro in Mindanao, Philippines. Our journey in Oro Youth was a product of ownership, co-ownership, and co-creation. The youth owning their space and responsibility in local governance, establishing a relationship with local leaders, and institutionalizing the vital role of the youth under a progressive leader, our Mayor Oscar Moreno. In 2018, we successfully lobbied the passage of the Oro Youth Code, a city ordinance that institutionalized youth participation in local governance. This code paved the way to the creation of the Oro Youth Development Office, now a permanent entity in the local government of Cagayan de Oro, which caters to youth affairs with budget allotment and manpower. The Youth Development Office's primary mandate is to be the training hub for youth development, with focus on leadership development and technical support to youth organizations and sangguniang kabataan officials, out-of-school youth development, and adolescent and youth sexuality and reproductive health. Our office is an active member of the Information Service Delivery Network, or ISDN, for adolescent health development, where we work with local, national, public, and private agencies and harmonize our plans and programs for AYSRH. In the year 2020, when Cagayan de Oro joined the Challenge Initiative, one of its challenges is the increasing rate of teenage pregnancies. Mayor Oka tasked our office to work with the City Health Office and City Improvement Division, together with the other agencies, to join his call for action to address AYSRH challenges through youth empowerment. We assisted our sangguniang kabataan officials in ensuring that AYSRH is part of their comprehensive development plans that will guarantee programs and budget for AYSRH. Currently, we are part of the co-facilitators of the Leadership for Adolescent and Youth-Friendly City or LIFE-C program, one of the TCI high-impact approaches, where we also provide mentoring and coaching to the youth leaders of the pilot barangays during training and implementation of their behavior change design plans. TCI made different city offices and other agencies work together from analyzing the disaggregated data, removing duplicate AYSRH interventions, and trying out-of-the-box solutions that led to the reduction of our adolescent birth rate from 80.9 in 2019 to 49.46 in 2021. As we deepen our understanding of AYSRH, our city, through the Youth Center, has established a strong partnership with the public and private high schools in the city to work together for adolescents and youths in schools. This partnership produced programs such as information campaigns and Festival of Talents on AYSRH, which were also done online, especially at this time of pandemic. TCI High Impact Approaches Life C program inspired us to note that leadership development is critical in addressing the challenges related to AYSRH. The challenges of the youth should also be co-owned and managed by the youth themselves. With this, we'll be launching a program dubbed as Young Leaders for Health, or YLH, also a relevant capacity building and city youth office managed program in this time of pandemic that aims to create an enabling environment for the youth to be more proactive and collaborative in addressing health issues that are affecting the youth in the city. As I close, what we aim to do is for our young to be not just mere recipients of government service, but they too are our partners in governance, providing safe spaces for meaningful youth engagement.
Being an elected youth leader representing all the youth in Puerto Princesa with the same objective of impacting positive change, together with 660 young officials of Sangguniang Kabataan, more than 50 youth organizations, and other allies for youth development, I have responded to the challenge of ending teenage pregnancy as we join in the Challenge Initiative. Back in 2018, the whole province of Palawan, including this city, got the highest reported teen pregnancy among the other provinces in the Mimaropa region, recording 4,561 cases, covering 60% of the total teen pregnancy incidents in the region, making us number one in the list. While in the same year, the City Health Office reported an alarming rise in STI HIV/AIDS cases with 295 individuals in the province, contributing 50% of the total cases in the whole region, again, making Puerto Princesa on the top of the list. I participated in TCI's Live C for Youth Leaders last July 2021, together with other 15 youth leaders, which gave me a wider understanding on how to use my leadership skills further to address the high early pregnancies in my city brought about by limited AYSRH facilities, insufficient data and referral procedures, limited access towards right information, challenges to the social norms and culture, among others. So, what the youth have done and accomplished so far. So here we became the youth health advocates. We started with education and information campaign and services on SRH, family planning and responsible parenthood, and others, especially in social media platforms, reaching almost 7,000 adolescents and youth. We also equip ourselves with some skills during our live C sessions and made follow-up dialogue to different stakeholders to harmoniously align our plans and actions together. In 2020, 63% of the SKs have appropriated an annual SRH budget. Some even distributed pregnant women kits to help them take care of themselves and avoid the probability of maternal deaths. In 2021, I'm happy to report to you that we have managed to get the full commitment of SKs, for 100% of them have appropriated the same. With the collective efforts of the different stakeholders implementing different AYSRH programs and our other high impact approaches at TCI, the number of recorded teen pregnancies in the city decreased by 24% in 2021. That's 435 versus the 2018 data, of which is 1,051 cases. So this 2022, the youth officials continues in taking up the challenge. Of course, here, by establishing relevant data banking system and management system, training youth in peer motivators, ambassadors for SRH, coming up with systems, improving the access of sexually active youth to right information and contraceptives, and joining the local councils for protection of children and school board for the in-school sex education programs that may drive the adolescents to spend their time developing themselves aside building families at a young age. And a lot more programs, projects, activities, and policies that may hereinafter contribute to our Filipino dream. That is ending teen pregnancy, saving our youth from an unsafe sexual environment, giving them a healthier place to live in. That's all. Thank you very much.
Thank you, speakers. Again, if you have questions, please use the Q&A functions of this platform. And if you have comments and personal insights, kindly use our chat button. Moving on to our second panel, we will have two discussants who will talk about ensuring sustainability of AYSRH gains despite leadership change. First, we will have the Health Education Program Officer of the City Health Office of Dipolog, Nurse Donna Mabuhay, who will discuss the role of leadership in instituting change. To be followed by the Honorable Mayor, Oscar Moreno of Cagayan de Oro City, who will talk about sustaining CDO gains through empowering the youth, barangays, and intersectoral groups for AYSRH. Nurse Donna, you may now start.
Mabuhay from the Philippines. I am privileged to share with you the journey of Dipolog City in ensuring sustainability of our AYSRH efforts through the leadership of Mayor Darrell Lexer, CEO. The main call to action by Mayor Darrell to us was to produce real-time data on AYSRH. He believes that initiatives that are based on data would be more sustainable as they are responsive to the real situation. After our inceptions meeting, where he chose us to be his trusted group in implementing the system changes, our group, the Team Baby, put our leadership into action in partnership with TCI and the Department of Health. We started building a monthly AYSRH database based on the DOH monitoring tool called FHSIS, or Field Health Service Information System. We identified the sources of data and realized that we have to also use other program databases aside from the FP data. Thus, the coordinators of FP, MCH, and FHSIS started working as a team with the TCI, orienting and later coaching the midwives on why we needed to collect, analyze this data. Data quality check was also practiced as we noted data errors. With available data and information, the challenge on teen pregnancy surfaced. I presented the data and analysis to our city mayor monthly. Seeing the urgency of our situation, Mayor Darrell called for a collaborative action from Team Baby, which led to a unified comprehensive response and paved way to planning and fund sharing by Team Baby using the program design as our platform. Our process on monthly data monitoring has become part of the City Health Office protocols. I agree with Mayor Darrell. TCI made us understand deeper AYSRH and its systems by introducing to us tools like the City ASRH Roadmap and Race tool, which we use in assessing our system performance. From our data baseline assessments, both of tools, we saw our gaps, which as leaders we address not as part of compliance to TCI requirements for graduation, but because We know that in addressing them, we would have a more responsive system as it is aligned to the four concentric circle strategy of TCI to address teen pregnancies, leading to better services that would be felt by our adolescents. Our efforts were validated in our RACE tools course since it measures the sustainability of interventions and self-reliance of the LGU. We were able to reach 85% mature level in 4 months interval from round 1 with 75%. What led to this? These are the highlights. With our mayor's leadership, we are already doing well in Domain 1. For Domain 2, all year-round trainings of our service providers related to adolescent-friendly facilities and postpartum family planning services was started. For Domain 3, implementation of TCI approaches are ongoing, thus, there are no improvements yet. For Domain 4, we engage the community where the youth and their parents this time participated willingly in our activities, empowering the community, which made them voice out their concerns and needs, and influence others would go a long way. I personally feel grateful for more co-owners. Mayor Darrell's sense of urgency made me feel that this is not only the battle of the City Health Office. For our next steps, comprehensive sexuality education in the pilot schools and legislating our ISDN using our program designs plan will be done. The role of the local chief executive is strong leadership, ownership of the problem and strategies in co-creating solutions with stakeholders together with the city key leaders are still essential factors for any local government to make change and sustain gains for the betterment of its constituents. Thank you.
When I started my career as a public servant some 24 years ago, I had always put health at the top of my agenda. When I became mayor of Cagayan de Oro in 2013, of course, health was one of the deliverables that I wanted to do and deliver and serve the people with. With the Challenge Initiative, we learned about making changes and initiatives sustainable by following the Kotter framework of leading change. So the first thing I did was to create a sense of urgency among my department heads and with my guiding coalition. The community members through the inception meeting and local lawns where I shared my public narrative on this issue. Now, that led me to the forming of the powerful coalition, technical working group of the Information Service Delivery Network. My wide array of reach and network with civil society groups gave me the chance to invite them to co-own with the city government the agenda of addressing adolescent and youth sexual reproductive health, or AYSRH. No? And then, so I invited, of course, the key departments of the city government, City Health Office, the Community Improvement Division, the Oro Youth Center, Oro Youth Development Office, of course, the Sangguniang Kabataan Federation, City Social Welfare and Development, J.R. Bora, the City Hospital, and Public Employment Services Office, together with PIAP, Cagayan de Oro, and the Department of Education through the City Schools Division. Also, the City Police, City Agriculture, POPCOM, Region 10, and the Department of Health Center for Health and Development, Region 10, Department of Health Regional Office, and many other organizations. Of course, certainly the Challenge Initiative, Zwillig Family Foundation, as well as Rich Health. And then part of the co-ownership phase was the creation of a vision for change. Together with POPCOM Region 10 Regional Director Aldrin Omega, Department of Health, and Regional Director Dr. Jose Lacuna, and SK Federation President John Michael Seno. I took aim at engaging with TCI's project on establishing adolescents and youth-friendly cities to respond to the Cagayan de Oro's AYSRH problems, particularly the increasing number of teenage pregnancies. Now, the next phase, of course, is the communication of the vision, as well as the key elements of our program. The TCI endeavor of addressing the complex AYSRH problems is a product of collective effort of the Guiding Coalition, barangay leaders, and the Youth Council, and the allies and those, even the non-allies, but who have bought in the creation of solutions for the AYSRH problems. The youth leaders played a very crucial role, especially as they realized that the teenage pregnancy is their problem and that they need to help solve that problem, to respond with other stakeholders. Next step is the empowerment action. And this is a key element of our program. Through the TCI interventions, we were able to capacitate and bring more bridging leaders together among the CLT and ISDN members, barangay and youth leaders, who now have the clarity on the whys and whats, and started to co-own and co-create solutions to the AYSRH problems. This resulted in the convergence of our Guiding Coalition and many other and functional bodies at the city and barangay levels, thus making the service delivery more responsive to the needs of the adolescents and youth. Crucial here is the linking together between the youth leaders through the SK Federation and the youth leaders of the various universities and colleges in the city. Next step, of course, leadership for adolescent and youth-friendly cities for barangay and youth leaders. 6 out of 10 pilot barangays, villages were trained in this, no? And then 150 barangay leaders have completed the training module 1, and then 20 youth leaders have completed the module 1 training. The barangays allotted budget for counterpart funding during the training. Of course, there were 23 peer educators trained in order to assist in adolescent-friendly and health facilities. And youth leaders help in rolling out the peer educators training with City Health Office, CIAD, City Information Department, POPCOM 10, Department of Health, and all our other partners. Pre-marriage orientation and counseling also played a very important role. 2,315 couples have participated in this phase. Family planning competency-based training for rural health midwife was also conducted. 12 rural health midwives were trained in family planning competency-based training too in pilot villages and highland villages, despite of the pandemic. Of course, the protocols had to be observed along the way. Creating quick wins. With these accomplishments, we gained confidence to leave behind on the part of the city in the hands of our leaders, who will continue to work for the improvement of the AYSRH system and achieve the best outcomes possible in reducing teenage pregnancy in the city. Co-ownership really played a very, very significant role here. And lastly, the latest race assessment results showed improvements, which gave us the assurance that our gains and accomplishments will be sustained even with a change of leadership. Building on the change, the ISDN partnership agreement has helped in harmonizing the youth services and programs of the various government and non-government agencies directed towards empowering the youth citizenry. Now, this is my last term as mayor of Cagayan de Oro, and I have decided to go back to the province of Misamis Oriental, of which Cagayan de Oro is a part, to run for governor, which was my position before I became mayor of Cagayan de Oro. As I am about to do that, I have, of course, explained to the people of Cagayan de Oro my plan, and I hope that they will be supporting me. I am also looking at integrating both in Cagayan de Oro and Misamis Oriental the programs that we are doing now. No, hopefully we would be able to replicate this in the province in a much larger scale. I will certainly not be turning my back on the city, as I have prepared my allies and, of course, my potential successors on the bridging leadership strategies. And part of my transition plan is to help them align their vision for a healthy and empowered youth through coaching and mentoring. Thank you very much and good day.
Thank you, Nurse Donna and Mayor Oscar. To synthesize the discussion, let us welcome the program specialists of the Bill and Melinda Gates Institute for Population and Reproductive Health, Johns Hopkins Bloomberg School of Public Health, Ms. Laura O'Donnell. Over to you, Laura.
Thanks, Raymond. I'd like to take a moment to thank all of our presenters today for joining us to share their experiences and learnings in capitalizing on leadership principles to overcome AYSRH systems challenges to make cities adolescent and youth friendly with the goal of reducing teenage pregnancy. Through the use of TCI's high impact approach, the Leadership for Adolescent and Youth Friendly Cities approach, known as LIFE-C, city mayors, city leadership teams, barangay, and youth leaders are empowered to address their concerns. The first panel focused on the importance of collaboration and eliminating duplication of efforts, strengthening partnerships to advocate for more responsive and streamlined AY programs, and noteworthy use of data for decision-making. With the meaningful engagement of youth in these organizations and conversations, young people in the communities are empowered to take an active role in leadership and advocacy for themselves and their peers. The second panel emphasized the multi-sectoral engagement of stakeholders and the impact of co-ownership and co-creating solutions with leadership to make and sustain positive impacts that they've already achieved. This helps to promote the long-term sustainability of the program throughout leadership transitions. The Philippine program and this leadership module is truly unique. We can clearly see that the leadership module has led to a more responsive leadership and governance system from the outset, where the mayor, the leadership teams, barangay, and youth leaders, in close coordination with POPCOM, are working in unison towards the same goals. We are really excited about all the successes that we've seen so far in the Philippines and their commitment to adolescent and youth-friendly cities. At this time, we're going to take a few minutes to review some questions that have come in. One of the first questions that we're going to take a minute to answer is, how did you manage the reduction in teen pregnancy cases in the cities despite the pandemic? I'd like to get Mayor Oscar Moreno to answer the question first.
Good evening. Good evening.
Could you let us know what was the biggest challenge in the pandemic and teenage pregnancy that you faced?
Well, because of the pandemic, classes were held off. No, so there is no. We didn't have in-person classes, and it was very difficult to. One would have difficulty in imagining where our children would go. Although the city had asked everyone to stay at home, but it would be very difficult to sustain that for a long period of time. And we've been having the pandemic since early to 2020. So it's been more than 2 years now. No? Fortunately, today, we are already under alert level 1, where there are no more restrictions, although because vaccination level is quite high. But it was difficult, especially during periods when there were surges, because children were, our teenagers were essentially, they did not know where to go. They were asked to stay at home, but in fact, they were required to stay at home. But of course, in the neighborhood, they would go around and go to their friends and so on and so forth. It was difficult then, largely because there were no classes, there was no school. There were classes, but they had to do it through modular, through online thing, no, and that has been very, very difficult for our children.
Thank you, Mayor. We appreciate your insights, and hopefully we're all past this pandemic thing soon.
Yeah.
Mayor Darrell, do you have any other insights to add based on your experiences?
Hello. Because of pandemic, now we realize that it's very important to improve our health system and in priority the needs, no? And so that we will be better prepared in case there's another scenario like. So it's about improving more our health system.
Great, thank you so much. Could I ask Mayor Moreno, how has bridging leadership helped in pushing the AYSRH work forward?
I'm sorry, I did not get that, please.
Oh, that's okay. How has bridging leadership helped in pushing AYSRH work?
Yeah. Bridging leadership has been very, very crucial. And I was fortunate because when I was governor some 12 years ago, I attended a program on bridging leadership, and it was almost 2 years. And since then, as mayor of Cagayan de Oro, we've been having programs that required bridging leadership norms and modalities. The beauty of bridging leadership is that you realize that you cannot solve the problem alone. So you need your guiding coalition, you need support, not only from your team, but also from the community. And then the process of ownership and co-ownership and creation and co-creation. These processes are very, very crucial. So no matter how difficult the problem is, the bridging leadership philosophies are very, very effective. And what the beauty also is that by adopting bridging leadership philosophies, everybody is engaged in a meaningful way, and everybody's commitment is obviously and obtained and nourished and developed as well. So bridging leadership is certainly a must, especially in government.
Thank you so much, Mayor. That was great. Mayor Darrell, the same question to you.
Bridging leadership is it's very essential, especially for us local chief executive need collaboration all sectors and giving or providing or informing, giving awareness and ownership, no? Responsibility, especially on health. We should unite and work together as one so we can address all the concerns, the problems, and improve our services together as one.
That's great. Thank you so much, Mayor. We appreciate you answering our questions. I do have one more question for JP. JP, how did they empower the youth not only to focus on service delivery, but also policy work? And what did you do for youth empowerment for AYSRH that will be sustained despite the leadership change?
Thank you so much. Sorry.
That's all right. Oh, JP Santos, I should.
Oh, sorry. Sorry.
That's right. Thank you.
Yes, actually in Cagayan de Oro, we have a very supportive leadership under our mayor, Oscar Moreno. And we passed an ordinance which created a youth development council chaired by our SK Federation president, where it's really a multi-sectoral youth council, where it's not just focused on programs, but more, it's actually the highest youth policy recommending body in the city. So in a way, how to sustain this is that, yes, we have passed the ordinance, so hopefully we'll be able to sustain this even in the change of leadership. For our AYSRH programs, we also have a very dynamic and active youth center, which is from our community improvement division, where it's actually youth-led, and they're actually in charge of demand generation. So they have done various programs on information dissemination of AYSRH, even at this time of pandemic. So they actually maximize, the online engagement. So this can be sustained because both we have as Mayor mentioned, we have a coalition already in the city through our city leadership team and a very active information service delivery network where there's already a MOA that has constituted this body. So that is one of our ways in ensuring that the programs on AYSRH will be sustained even in the change of leadership. Thank you.
Thank you so much, JP, and we really appreciate your work. And it sounds like you guys have a lot of really great things going on. Again, I'd like to thank all of our participants and panelists and everyone here today. At this time, I'm going to turn it over to Executive Director of PopCom, Dr. Perez, for his closing remarks.
Thank you, and good evening, good day to everyone. I'd like to especially greet Mayor Moreno of Cagayan de Oro. I started work in PopCom during his first term as mayor in 2013, and I know he has had major struggles along the way, COVID not being the least. And of course, Mayor Darrell Uy, good evening. And thank you for your wonderful work in Dipolog. And of course, Mayor Byron, who is not here, but I'm sure he has made a dent in adolescent health in Puerto Princesa, as represented here by Councilor Micah. Let me first say that overall, teen pregnancy in the Philippines has declined in 2020, even in the middle of the pandemic. But the declines reported by the mayors and Councilor Micah are outstanding and beyond what the other LGUs regions have achieved. And that is really a testament to how local governments have performed during the last 2 years of both a public health and economic crisis. No? We have seen, for example, in Dipolog, the personal leadership of a mayor, no, touching base with his community, and in Cagayan de Oro, the comprehensive leadership of Mayor Oka, mobilizing different offices, no, even the police, he says, that he mobilized to address this kind of problems. And the community approach displayed by Cagayan de Oro, which I know has a community improvement department, and that really has done wonders for the population of Cagayan de Oro. While in Puerto Princesa, we heard about young people taking the lead. No? The SK, as represented by Councilor Micah, the youth are taking charge of their health. All of this shows that leadership is important in Philippine governance. The two mayors here present have shown the importance of the mayor, the leader, local chief executive, giving the signal. I think that's important in Philippine governance. No? If the leader does not give the signal that this is an important area of work, things will not go as fast. But the leadership shown by these two, and I'm sure Mayor Byron also in Puerto Princesa, gave the signal to everyone else, this has to be addressed. And it's important that Mayor Moreno and Mayor Uy are also thinking about sustaining this work. No? Because while we have had great success in the three cities in addressing teen pregnancy, there is such a thing as a reversal. A reversal can happen once schools open up, once people start being more mobile. A reversal can happen. And that is why we must sustain the gains made by the three cities today and sustain in 2022 and beyond. The economic crisis will also remain. Despite the fact that we may overcome the health crisis, the economic crisis will remain. Mayor Uy as a mayor and maybe Mayor Oka as governor will continue to face these challenges, and sustaining against a possible reversal of these gains, sustaining the gains will be key to the next terms, to the next 3 years of governance of our local chief executives. Let me end by saying that the gains that we have seen would not have been there if we did not have a good information system. As seen in all three cities, the information systems were much better. Decisions could be made because mayors and the department heads knew what was happening just in the nick of time. And this is important because all over the country, actually, the civil registrars, I'd like to praise the local civil registrars of all LGUs. They have been really coming up with the correct data on mortality, on births, and without their good performance, the mayors, the health, the departments would not have been able to do this, which is why the Philippines is able to monitor that well the situation in COVID. And all of that is because we have a decentralized system of governance that works, particularly in the cities of Dipolog, Cagayan de Oro, and Puerto Princesa. But let me give particular recognition to Cagayan de Oro, which is not only a major city, but it is a regional hub. And a regional center can make a great difference in the region where it is, no? Like Region 10. Students flock there, and the impact of a change in Cagayan de Oro can be region-wide. But that does not diminish the role of Dipolog and Puerto Princesa to make an impact in their provinces, because the center of governance in the Philippines today is in the cities and in the provinces. And that is where I particularly recognize the role of city mayors in leading the change for adolescent health. You are the key to solving this problem and in the future sustaining this. So my hats are off. My hat is off to your great work, mayors, councilors, young people, health workers, and population workers in the 3 cities of DCI. Congratulations again. Please continue the great work for your people. Maraming salamat po.
Thank you, Dr. GP. Thank you, esteemed colleagues, for your wonderful presentations and insights in your CP experience. May I request all the 152 participants to type yes. If you learn a lot today, could you type in yes? About the leadership approach, we welcome you to continue the discussion by visiting the community of practice at the TCI University and posting your questions and comments. We also want to make sure to share several resources that summarizes the TCI AYSRH programming experience, like what you are seeing on screen, the Adolescent Youth Friendly Health Services Philippine Toolkit. Please check these materials. Thank you for joining the TCI Philippine Hub webinar. Mabuhay!